I'm Randy Ellis, and I'm here today with Ed Lake, Director of the Department of Human Services, and Jamie Ledoux, who's the Director of Child Welfare Services. We're here to talk a little bit about what's happening within the agency. We're now about 4 years or so into the Pinnacle Plan, which was designed to help resolve some of the problems we've had with child welfare services. And we've had some progress in some areas and some challenges, and so that's what we're going to talk about a little bit today. Shall we just start off with one of the real, we'll start with the hard questions. As we've seen progress in some areas, we've also seen maltreatment in care or abuse in care go up for the first 3 years. Can you talk a little bit about why that may have been happening, and I understand it's starting to reverse itself perhaps a little bit, and what's happening in that regard?
Okay. Well, the big picture part of that is that this reform effort has many moving parts, and the agency was thrust into this effort having to do a whole lot of things all at once. So the Pinnacle Plan was approved, and immediately the agency was reorganizing itself to create the separate Child Welfare Division, trying to hire people, trying to get new supervisors and management in place. And it was rocky in the beginning. Then we were hit with a huge influx of the number of children in state custody right after all of this. It's been difficult in the beginning to get traction. And so when you have so many children coming into the system, not enough people to manage the cases, not enough people to follow up with children and families, you sort of set yourself up for problems. And so we've been working our way out of that, and in the last year and a half really have begun to see the sum of our efforts start to pay off in a whole lot of ways.
And there's been some dramatic changes, the closing of the institutions you had for children in care. Talk a little bit about that.
Okay. Jim?
Yes, so we made the decision in January of 2015 to close both of our state operated shelters, and that was a result of all of the efforts that we had that were ongoing for the last couple of years. We had been able to drastically reduce the number of children who were being served in shelters, and we were getting closer and closer to our goal of basically eliminating shelter care statewide to the extent that we can. And so it seemed like a next kind of logical step in the process to make a commitment to close those 2 state operated shelters. We had a higher than average kind of number of substantiations for abuse and neglect in care in our state operated shelters, and so that did play into our decision to close those shelters as well. And we set out a really aggressive timeline for that to happen, and we had a goal of having both of the facilities closed by the end of the last calendar year. We were successful in closing Pauline Mayer Shelter. We closed it in October of 2015, and we maintained that shelter open until the last child was placed, and we moved our efforts over to Laura Dester Shelter. So as of today, we didn't meet our target for closing Laura Dester, which was the end of the calendar year. It's still open as of today. However, we've reduced the number of kids in that shelter down to 13 as of today. It's fluctuated a little bit, but the goal is to keep the same way that we did with Pauline Mayer, to keep that shelter open until the very last child is placed. Our challenges now are we still have, although we've made significant strides in increasing the number of families that we have serving our children, the number of foster families available for our children, we still do have some gaps in our system. And as a result of that, that's why we're still challenged to be able to close the shelter, within the time frame that we would like to. And one of our biggest challenges right now is serving children with special needs. So children with developmental disabilities, for example. We have a lot of the children that are currently being served in Laura Dester are children who are in need of families who are capable of meeting their special developmental needs. That's one of the gaps that we have right now, and one of the things that we're continuing to work on is building our capacity to serve those children in family-like settings.
So if somebody had an interest in doing that, do they have to already have special abilities in taking care of kids with special needs, or do they have special training that you can help them with, or what's?
Yeah, they don't have to have already had experience. What we do find is a lot of the families that come forward wanting to serve these children have their own children or know children who have developmental disabilities, so they already have some familiarity with their needs. But we have other families who come forward who have never had any experience, raising children or serving children with these kinds of needs, and we do provide them, the child-specific training that they need to be able to care for these children. The last child that was at Pauline Mayer Shelter was a good example of that. We did a call to the public, essentially asking for someone to step forward, kind of did an explanation of what this child's needs were, and explained that if you were interested in meeting the needs of this child, to reach out to us. And we had several families who did, and we were able to find a really good match for that child in doing that. And I actually got an update on that child yesterday, and this family has made tremendous progress with this child, with his developmental delays, and he's doing things that are far beyond what anyone ever expected that he could accomplish in terms of his development in a short time period, just being with this family who had never experienced, didn't have any experience serving children with his kind of needs before.
And we also don't leave the family adrift. It's not like bringing a special needs child into the home and saying, go for it. It's, we can provide support services in the home to help support the foster parents. So they're not just having to do this on their own.
That's real important for people to know, because it's a little scary to just take in a special needs child without that kind of knowledge. I probably ought to point out that Laura Dester Shelter is in Tulsa, and Pauline Mayer is in Oklahoma City, for those that might not know. Tell us a little bit about the other areas where you've seen progress made in child welfare.
I think one of the major things that the court monitors have pointed out all along is, despite all of the other issues that we have confronting us, we have been able to keep a high pace of monthly visitation with our kids by our workers. And that's really important on a lot of levels. One, letting the child get to know the workers so they understand who the workers are and that they're helping them. And it's also eyes and ears in the case, in a broader sense, in that workers visiting with the children can pick up on problems and issues and potential serious problems much better than if we're only seeing them every once in a while.
And one thing people who watch from afar may have difficulty envisioning is that you've actually been hiring child welfare workers. At the same time, you've been making some pretty strong reductions in some other areas. Can you talk a little bit about what's going on at DHS in regards to that and the budget and how that's impacting what you're doing and the challenges that creates?
Mm-hmm. About a year and a half ago, when we felt like we really were stuck in place and received a pretty harsh report from the court monitors, we sort of regathered, worked with them, came up with what we were calling core strategies, which is nothing more than saying, hey, look, what are the essential things you need to do to address some core issues? Shelter use, foster home recruitment, and workload, because that workload in particular, as Jamie said, is key to our success. So last spring, we began a concentrated effort on a monthly basis to hire additional positions working towards a workload standard that we agreed upon with the monitors. The problem is that we haven't received any appropriations for those, so we're having to find savings and funds within the department, both in child welfare and elsewhere, to meet those costs. So that's contributing to the department's budget problems this year, on top of the 7% revenue failure issues and whatever our fair share is deemed to be going forward. We've also had to absorb the cost of the increased numbers of children in care without appropriations. We have been so successful in adoption assistance, it costs us more money in adoptions, unfortunately. And this will be the third year that we've had to absorb increased costs because the state's share of the Medicaid match has gone up. So all of those things together have put us in a deep hole inside DHS before we even have to make these other reductions. And
you've made reductions in a lot of areas. You've protected child welfare to the best that you can, anyway. Yes. I don't think you've made any cuts in employees in that particular area, but it's come at a cost. I mean, you've lost a lot of employees. How many have you cut within the last?
I think we're up to about 1,200, and we have Right now we're looking at about 400 more voluntary buyouts, and we project that it may be another 1,000 positions that we'll have to reduce just to set our budget for next year, again, not counting any further reductions that we have to make. So it's an unpleasant scenario. It's just very difficult because we just don't think we can regress in our support of the child welfare. The stakes are too high. It's important to the department, it's important to the state, but it's more important to the children and families we're trying to serve. We have been appropriated almost $110 million through the Pinnacle Plan, but through the support of the legislature and the administration, and we couldn't have done it without that. We've put another $50 million in, not counting the increased payroll costs for adding new workers of our own. So it's taken that much to try to get the ship righted.
And when you have to make the cuts in the other areas you serve, tell people a little bit of what that entails. I mean, you take care of the elderly. You're responsible for people that are very severe physical handicaps as well as mental handicaps. So if you try and make all your cuts, you reserve an area from a cut, then you create a risk of having people fall through the cracks in other areas.
Exactly, and that's sort of where we find ourselves. And I think most people don't understand when you look at our budget and you look at our state appropriation, we don't have control exactly over all of that appropriation. For example, we have programs like the welfare, TANF program, the SNAP, food stamp program, child support, some child care development funds. There are maintenance of effort requirements. In other words, if we don't contribute the state's share that's been agreed upon, we're in danger of either being financially penalized or losing the entire program. So you start with a budget and you take off this maintenance of effort amount, which is $90 million right there. That takes us down to another level, so that any reduction is really you have to look at from that point, which makes all of the percentage reductions even more severe for us.
What are you hearing from the legislature at this point as far as their ability to preserve you from cuts, or whether it's not going to be possible? What are they telling you?
I would say we haven't heard anything positive so far.
Well, that's discouraging.
Yeah, yes. I think, in fairness to the legislature, I think here soon they will be turning, full bore to the budget issues. A lot of things around policy so far that have been addressed, but it is a severe crisis for DHS, and we are a public safety agency. We are a core, I think we have the core missions of state government along with several other agencies, and we're going to have to really fight to keep ourselves together.
Jamie, you're saying you actually are starting to see some declines of children in care now, that you're making some progress in that regard?
Yes, we are. Over the last probably 14 or so months, we've seen an 11% decrease in the number of children in out-of-home care. So that has been really significant in our efforts to reduce the workloads that children or that the staff have, the number of children that they carry. Director Lake mentioned our ability to get our staff closer to where they need to be in terms of workload standards, and in doing that they've been able to focus more on the needs of children and the needs of families, and they're able to engage with these families at a different level than they were before, when they had higher than average caseloads, sometimes double the caseloads that they were supposed to have. They weren't able to spend adequate time with the families and with the children, understanding their needs and helping to facilitate permanency. So our efforts in being able to reduce the workloads really has impacted our ability to safely achieve permanency for a number of children in care, which has resulted in an 11% decrease in the overall number of children that we have in care right now.
And I'm hearing that maybe there may be a reversal also in the abuse of children in care also starting to drop. Is that kind of what you're seeing?
So we have preliminary data for the last quarter of the last calendar year. So the quarter that's October, November, December of 2015. We did see a significant decline in the numbers of children who were experiencing abuse or neglect in care during that quarter. So what we need to see is that trend continue, obviously, to make sure that we don't go back up. We have a number of things that we're working on there to impact the abuse and neglect of children in care. And Director Lake had talked about, the workloads of staff, and I mentioned the workloads of staff, and we had focused early on decreasing workloads and increasing the number of families that we had available to serve children. And Director Lake also talked about our visitation rate of how we see children, how frequently we see children in their placement settings. Those were the things that we were working on in the very beginning of the Pinnacle Plan of the reform effort to impact maltreatment in care, because we knew if staff could spend more time with the children in care, they could, they were better equipped to recognize children who were at risk or families who were at risk. And then we knew if we had the right number of foster families and the right type of foster families to serve the needs of children, then we could reduce the incidence of abuse or neglect in care, and if we were able to see them more frequently. So we focused heavily on those 3 areas in the beginning, and as we began to see progress over the last year in those areas, particularly number of foster homes and, like I said, the workloads, we started to reevaluate maltreatment in care, and not seeing the numbers or the percentages having gone down to the rate that was acceptable or considered acceptable by the national standard. We then engaged in developing a set of core strategies that were really specific to what was going on, and it involved us undertaking a comprehensive analysis to analyze kind of what the trends were. We looked at the substantiations that had occurred, so the confirmed findings of abuse or neglect in care. We looked at those over a period of time and were able to identify trends. And so in identifying those trends, we were then able to come back and, as I say, develop a really targeted set of solutions that were geared towards what we were seeing as the issues. And so what we do with maltreatment in care is we break it out into 2 different categories. We have children who are served in family-like settings, so traditional foster homes and therapeutic foster homes and kinship foster homes or relatives. And then we have children who are served in higher levels of care, so those would be group home settings, hospital facilities, anything that would be considered an institutional setting or congregate care setting, and that includes shelters as well. So we really had to separate those 2 out because the risk to those children and the reasons that those were occurring were two separate reasons. And so we have strategies targeting each of those areas. And so what we've done specifically based on what we learned for children who are being abused and neglected, specifically in foster homes, we looked at the history that these families have had. And when I talk about history, I mean many times when families, particularly as we're looking to find relatives to place children with, or kinship family or kinship members to place these children with, sometimes there may be some type of criminal history, that might be some type of minor history, or some type of previous child welfare history, such as previous referrals of abuse or neglect that may have been not substantiated or not confirmed. But those types of things have to be looked at and considered into how we weigh risk to children. And so we realized that we need to really streamline our processes and how those families were evaluated to make sure that we are applying the same standard across the state. So we've moved to centralizing that review process. So if there's any kind of criminal or child welfare history that needs to be looked at, we have a comprehensive review process that they go through. And the same goes for when children are placed into those homes. So for example, if there's a new referral or a new allegation of abuse or neglect in a foster home, we have a heightened review process for what that looks like, even if that referral is what we consider to be screened out, meaning that the referral didn't rise to the level of an allegation of abuse or neglect. Sure. Maybe it was considered a policy violation, for example. Those are many times screened out, but we have a heightened review process for how we look at those, even if those referrals are screened out and not accepted for investigation. We have a collaboration that occurs between the foster care worker who is working with the foster family and then the permanency planning worker who is the child's worker, and they work to develop a plan with the family to make sure that we have enough eyes in there and enough supports in there for the family that they're able to properly and adequately care for the child and meet the child's needs. We also have made changes to the way that the requirements that we have of our workers for how they're assessing safety when they're visiting children in care. So Director Lake had talked about, it's always been a strength for Oklahoma in our visitation, the rate that we visit children in care. We've always exceeded standards in that area. And so when we were able to start reducing our workloads of staff, we then began to focus more on the quality of those visits and making sure that when staff are out there, they're spending adequate time really assessing safety and assessing the needs of children, and not just the needs of the children, but the needs of the entire family, so the foster family and the other children that they're serving in the home. So we've made changes to our expectations, included in our training and our documentation of how we work on ensuring staff have what they need to adequately assess safety and be able to recognize, like I said, if a child is at risk, in a home, to prevent any abuse or neglect from occurring in that home.
Let me ask you this. Obviously, you need people to serve as foster parents that are capable of doing that and have that talent. Is there anything short of that? People that may not be able to take a kid in their home. Is there anything that people out in the public can do that would help? That's maybe if they think, well, I can't quite tackle that.
One thing we've sort of lost by not operating shelters was a better connection with community volunteers or people interested in helping. So there's, we have to be careful. Unfortunately, we've come to a time and an age when you have to do background checks on everybody who volunteers, and you can't be too careful. And even then, sometimes things go wrong. So I think when people want to volunteer to help a child or support a family, the rigmarole, kind of gets in the way for some of them. But there's always room for people that want to help and develop a relationship with a child, and I think we would like to see more of that happen.
And so maybe if it's not directly with DHS, it could be things like Big Brothers, Big Sisters, organizations like that, where if they get the care they need, maybe they won't end up in the system.
Sure.
Exactly. Yep.
Or even reaching out to, we have our private agencies who we partner with to place children. So we have private agencies who recruit and support foster families. So even if someone is unable to be a foster families still need support. So reaching out to those organizations who train and support those families and seeing what supports can be provided to the foster families who are there serving the children. We also have another sort of really neat initiative that's going on in our state right now, that something called the Care Portal, and we launched this in Stevens County, and we launched it recently in Tulsa County, and we're moving to Oklahoma County now. And it really is a way to partner, a way to engage and connect the faith-based community with foster children and the families of foster children and foster families. So it's really a way to identify those people who do want to provide supports to children and their families, or even foster families. How do they connect and how do they know where to go? So it's a way for a worker, for example, a child welfare worker, if they identify a family on their caseload or a specific child on their caseload who has a need, they reach out to this Care Portal, and the Care Portal connects a volunteer or someone who has a tangible resource or good to provide to the family. And we're able to connect families who want to help children in the system that way as well. So we're hoping to be able to, as this is successful and working out all of the kinks with something new, that we can continue to spread this, statewide eventually.
And with foster parenting, although we need foster homes that are available all the time, and pretty much that's what they do, but there's room for parents who want to just support other foster parents by being respite homes. So we still have room for people that can do it periodically to give other foster parents a break. That's another option for people. It's difficult, I think, for the people in the public to understand the system that we're operating in, that there is such an interplay of actors and issues, and the whole thing with mistreatment in care is concerning. As I said, I think our rate is too high. We're still struggling to get that down. Although the percentage is low, it's still a number of children. But for example, we close our shelters, we reduce shelter care statewide. We have more foster homes so that we can place children into family settings instead of congregate settings. We don't have that many group homes in the state, but yet we still don't have enough resources. So You may have foster homes that are overcrowded. They may have too many children, or they may not be matched up well with their capabilities and the child's needs. So that's our next area of breakthrough, is to be sure that foster homes have a manageable number. It's not fair to overload a foster home and expect them to manage. And second of all, that we have done a really good job of understanding the child's needs and the foster parent's capabilities, and much less troublesome things will occur if we do that better.
Thank you. I appreciate you coming down here and visiting with us today.
Our pleasure.